Good afternoon, students. Today we are going to demonstrate a simulation-based experiment software for the preclinical study. Okay. So that type of software, which is MyCalPharm software, we have used in pharmacological experimentations for the experiments like rules of drug administration, efficiency of medicine. Now, here we are using the new software, which is a MyCalPharm software. Okay. So purpose is same. We are avoiding preclinical studies by using animals, and hence we are going to use simulation-based experiments. We will be introducing today MyCalPharm software. There is instrument demonstration in the experiments available in that software, and the experiments, which experiments are available in the software. Now we have to first of all log in a MyCalPharm software, and then we have to select on the experiments and then a tutorial. Hence, we are going to teach some experiments, then we will be going to select on a tutorial. Here, the exam mode is also available, practice mode is also available. So, whatever our purpose is there, based on that, we have to select the options. Now, you can see here the various softwares available. Yes, effect of drugs on privatized biosystem interpolation method. So the bioassay various methods which are various type of bioassay. The interpolation bioassay 3.4. All the interpolation method, all types of experiments are available. So first of all, just tell me why we use this type of softwares for preclinical screening.
Because we can sacrifice for every practical activity.
Just for practice purpose, we cannot sacrifice the animals. So we are using that simulation-based experiments, and this software, in their experiments, they mimic the role of animals in the experiments. Okay. So we will do one experiment here and just see how it works. So we have selected the experiment, which is the effect of analysis, which is from your syllabus. So here you can see the objectives of that experiment to demonstrate the effect of centrally acting analgesics. The drug they are given is pentaglucine on a pain threshold in a mice using hot. Okay. Now which type of formulate we are using here? It is nothing but your Eddy's formula. In a pharmacology one, we have already studied about Eddy's formula. Yes. Now you can see the Eddy's hot plate here. The Eddy's hot plate is a device used to give heat stimulus to the cause of mice or rat. Means what? Yes, here the heat is served as a pain. Now a metal plate at the top of the hot plate apparatus can be heated in a controlled manner and maintained at the required temperature for the duration of the experiment. The whole duration of the experiment, we have to maintain the temperature of that particular metal plate which is present in their Eddy's hot. Now, this plate you can see here. This is the lid, and here the plate, the metal plate is present. This is nothing but the hot plate. We have to keep the animal on that plate for the observation purpose. And how much temperature we have to maintain? 51 to 55 degrees Celsius temperature we can maintain. Next is principle. They have one principle of each and every experiment. Now we can start experiment. How it will make this. You can see it. So they have included the various videos of the experimentation which they have performed and in this experiment. Okay. There you can see the demonstration of them. They have divided all the animals, 12 animals in a two. One group is what? Medical treated group, and second group is what? Your drug treated group. Means what? In a medical treated group, we are going to inject the saline, yes, for the comparison purpose. And in a drug treated, your drug, which drug? Pentazocine. Now set temperature. You can see here, they have kept the animal on a hot plate and they are ready for this. Once the animal has shown the response like jumping or falling, you have to withdraw this animal and we have to record the time at which time the animal has started to show the response. Yes, here all of you. Same we have to do for the critical treated group and drug group. Now the observation include the mouse selected an average number. Means we will be going to evaluate or observe these type of responses in a various time intervals. For example, 15 minutes, 30 minutes, 60 minutes, and 1 hour. Generally, we are going to record or to consider values of after 60 minutes of drug administration. Okay. After 60 minutes, we have to keep this animal on hot plate and we will wait until this animal is going to show the response, and at which time the animal started to show the response, we have to record it. Then after we record all the animals, we will record for all the animals, then we will take the average number of dose and this average we are going to use for our calculation, for calculating percent analysis effect. For calculating percent analysis effect, we will be using formula post-drug latency minus pre-drug latency divided by post-drug latency minus drug. So that in that we can perform experiments by using MyCalPharm. And the more advantage of this MyCalPharm, we can save those readings, and you can attach the copy of the readings in your MyCalPharm. Okay. This.